Alright guys, welcome to the second part of our Integumentary System video lecture, and we will start from where we left in our first lecture, and we'll talk about birds. It's a really important and interesting topic, and they're so common, and these are sort of tissue injuries related to the skin and deeper tissues. And you can see that these are some of the reasons by which you can have burns. We always think that it's only related to temperature, but many times there are chemicals which are corrosive and they can cause burns. For example, a lot of acids. You can have electrical burns as well, and many a times there are radioactive hazards and they can cause really harm to our skin and deeper structures. So these are some of the causes by which we can get burn injuries. Now, we can have a classification depending upon the depth of the injury. So we can have a first degree burn if it's confined to, let's say, you can see this is confined to the top layer of the skin, the epidermis, the stratum corneum, and some of the basal layer and all those cells. So if it's confined to epidermis, it's the first degree burn. In second degree burn, you can see that it's not only the top layer of epidermis which is affected, now it has taken into consideration dermis as well. So for second degree, you will have involvement of dermis as well. And if it goes deeper than the dermis, then it's termed as the third degree burns. And you can see these are some of the examples. Some people consider 4th-degree burns as well. If it goes more deep, it involves muscle and it can go deeper into the bones as well. So depending upon the depth of the damage caused by the burns, they are divided into 1st degree, 2nd degree, 3rd degree, and sometimes 4th degree. Alright, there is a very famous rule of 9. So I'll just talk briefly about it to orient you what is rule of 9, and then we'll watch a video which really explains nicely that how rule of 9 is applied to treat burns. Now the idea of rule of 9 is to make sure that how much area of our skin is affected by burn, which technically means that it has a fluid or plasma loss from that area, and in order to replenish that fluid or to calculate that the amount of fluid which we need to inject into the patient, to calculate that prescriptive amount, we need to know how much plasma is being lost or is our body is continually losing because of the loss of the skin. So this rule of 9 is about the areas. So the front and back of head each constitutes 4.9%. So we have 4.9% front, 4.9% back. So our head totally constitute 9%. Then if we take each of these limbs into consideration, so 4.5 front of upper limb, 4.5 back of upper limb. So one limb constitute 9%. So it has to be 9% for each arm or each upper limb to be precise. And if we think about the torso, it's 18% front and 18% back. So it's a total of 36%. And for legs, it's just double of the arms because it has obviously a larger surface area. So 9% front, 9% back, so 18% in total for each leg. And then if you add these two legs, that will constitute 36%. So this is just a rough estimate, and rule of 9 helps us to determine how much area is affected and how much fluid or plasma we need to replenish for that particular patient. So let's watch a video. I think it will be pretty interesting.
In all burn-related injuries, it is important to estimate the total body surface area burned to determine the severity of the injury. But more importantly, calculating the total body surface area burned helps the practitioner use something like the Parkland formula to calculate a patient's fluid requirements after a significant burn. In order to do this, we use the rule of nines. Looking at this diagram of an adult, you can see why we call it the rule of nines. But let's break it down into something more practical. Taking a look at the head, it is worth 4.5% for the front and the back, or a total of 9%. The torso is worth 18% for the front and another 18% for the back, giving you a total of 36%. The anterior and posterior arm are 4.5% each, for a total of 9% in each arm. The front and back side of each leg is worth 9%, for a total of 18% for each leg. Additionally, the groin area is worth 1%. You could also estimate a small burn area by measuring with a palm, which is equal to 1%. In a pediatric patient, keep in mind that the rule of nines is slightly different. The head in this patient population is much larger, and so it is worth 9% for the front and another 9% for the back, for a total of 18% for the head. The other difference in the rule of nines is in the legs, which is worth 7% for the front and 7% for the back, for a total of 14% for each leg. All other percentages for the rule of nines in a pediatric patient remains the same as in adults. So when a patient comes into your resuscitation bay with extensive burns across the anterior chest, entire abdomen and groin, and burns to the entire surface of the anterior right arm, you could estimate that the total body surface area burned for this patient is approximately 23.5%.
So I think that was an interesting video which gives us an insight about calculating the fluid replacement for a burn patient. Now let's move on from burn injuries to cancer, and that's why we are studying oncology, which is the study of cancer. Now, whenever we talk about cancer, it is broadly classified into two types. The one which is benign and the other one which is malignant. So we'll just try to look at the differences between the benign and the malignant one. So benign is simple. It's less harmful. That's the first thing which we need to remember. And it is less harmful because it is confined within a certain area. For example, if this is a cancer, it is circumscribed or limited to this area. It cannot pass through this encapsulated area or capsule. So if the growth is confined to a certain area, that's a benign tumor, and because it is not spreading all over the body, it is less harmful. On the contrary, if this is a cancer mass, and if it's spreading all over our body, that's malignant. That is more harmful because it is spreading via blood. So blood is reaching all parts of our body. So the cancer cells are just moving to all parts of the body. It can spread via lymphatic fluid, which is again harmful because we have a lymphatic system working. So again, the cancer cells can spread throughout our body through lymphatics, and it can have local spread as well. So the cancer cells are crossing this encapsulated surface and they are spreading locally. So benign is less harmful, circumscribed within a surface, limited and not spreading. Malignant is more harmful, spreading everywhere. And let's have a quick example of each. So this is an example of, I think, lipoma. This is a lipoma, which is a tumor. You know, oma is tumor, and lipo is lipid, so that's a circumscribed tumor of adipose tissue, and you can see that there are some sort of confined boundaries here. So this is less harmful, sort of benign tumor or a benign lesion. And here you can see that if you have this black sort of growth and you can see that it's spreading everywhere, you cannot have circumscribed boundaries which can limit its spread, then it's a malignant tumor. It can be a basal cell carcinoma or a squamous cell carcinoma, that depends, but it's a spreading sort of thing, so this is harmful and malignant. Now, let's see how the tumors are classified. So we've talked about this tumor grading from a pathological perspective, and we'll see the tumor staging, and we will concentrate on this famous TNM classification. But before that, let's see what is tumor grading. So there are four grades: grade 1, 2, 3, and 4. Now, the difference between these grades are that if it's grade 1, then it says in pathology that it is well differentiated. And what I mean by well differentiated is that if we look at a specific cell, we can differentiate between its different components. So for example, this is a cell membrane, we can very clearly see it. This is our nucleus, and then we have all other cell organelles. It might be a mitochondria or a Golgi apparatus or any other sort of cell. But we can very well differentiate between the boundaries, the components, we can easily identify them. So that's a well differentiated cell. As the tumor progresses, then these organelles and structures gets damaged, and it is less, they are less appreciated, less differentiated, and difficult to identify. So you can see the change in contour. It's more difficult to identify the nucleus, and then in stage 3 it might be something like this. So they are poorly differentiated or very poorly differentiated. And I think we can just look at these Gleason scale, and you can see what I just talked, that you can have very nice clear cells here. And as we move on in this grading classification from well differentiated here to poorly differentiated, you can see that the differentiation or distinction between different cell organelles, its membrane, are just going off and off. If you look at the TNM classification, so T stands for tumor, N stands for lymph nodes, and M stands for metastasis. So depending upon the TNM classification, so they just give some numbers. For example, let's have T1, N0, and M0. So which means if it's T1, then there is a grade 1 tumor, good differentiation. N0 means there is no lymph node spread, and M0 means there is no metastasis spread. So this tumor is not spreading, it's just a tumor, really well differentiated. So it has a very good prognosis, a large number of chances that the tumor will be cured. On the contrary, if you have T4, N3, let's say, and M, let's say 3 or something, it means it carries a very bad prognosis, because the tumor has spread everywhere, it has involved a lot of lymph nodes, and it's a grade 4, so it's poorly differentiated. So a sort of prognosis treatment plan can be decided keeping this TNM classification or staging into perspective. And you have TNM classification for all sort of different cancers, whether it's a stomach cancer or in the GIT or the pancreatic cancer, and you'd have all these stages. Stage 1 is T0, 10, N0, M0, or whatever it is, but the whole idea is that TNM stands for tumor, nodes, and metastasis. Okay, Let's move on to a very common skin cancer, which is the basal cell carcinoma. And I chose to talk about this because it's the most common type of skin cancer which is prevalent. So, as the name suggests, it arises from the basal cells which are present in the epidermis. And if you remember, let's quickly try to go back and see the layer of the dermis. So if you remember this layer, so it somewhere arises from these layer of cells. Okay, so it arises from the basal layers of epidermis, and the color is either flesh colored, dark red, or brown if it's a later stage. And it has two very specific features. It's pear shaped, that this is when they talk about this whole shape, flesh colored, and that's a one which is the early stages, maybe brown if it's a later stage. And the two important things, that it has rolled edges. So you can see that these edges, they are rolled like this. So if you see this particular appearance on the edges, it means that it's pretty classic of basal cell carcinoma. And the other feature is that the center is depressed. So if you look here, that this part goes in and it has been covered by the rolled edges. So these are some of the features which you can appreciate if you're examining a tumor, that it has rolled over edges, spear shape, all sort of red brown discoloration, and the center seems down or depressed. Now this is just a quick assignment. I think it's pretty easy, but I thought to revise it, that Mr. T is advised that basal cell carcinoma on his face will probably not spread but will be localized. That's important. It will eventually destroy the underlying and adjacent tissue. The spread of cancer from one part of body to another is called, and we have talked about in our TNM classification, and I told you that if it's spreading, it has to be metastasis. So if the spread of cancer is happening from one part of body to another, that is metastasis. Now this is again a quick exercise. A 78-year-old male is diagnosed with basal cell carcinoma caused by overexposure to sun. He's advised that the most common site of the skin cancer is whether it's the armpit or face or stomach, and it's pretty obvious that if it's due to the overexposure to sun, then face is the area which is exposed to sun most of the times, way more than armpit or the stomach. Now these are some very common disease conditions. They are not cancers, but they are prevalent really commonly. So I just want to talk about each of them quickly along with the picture, and I hope it will make some sense. So let's talk about the first one, which is abscess. So abscess is a collection of pus at the site of infection. And here I want to revise everyone that a collection of pus, you might have heard in the video, is an abscess. And we have a couple of terms for pus, which we have. It's not here, but I want to revise. The first one is pyo, P-Y-O, and the other one is suppuration, which was one of our exam questions. So an abscess will somewhat look like this, that there is an infection of the hair follicles and the pus has formed inside. So you can see this red painful area on the nape of neck or the bottom of the neck. Now let's move on to the second one, which is acne. Acne are inflammatory diseases of sebaceous gland and hair follicles. Now the problem here is that normally you can very commonly think about all those pimples, all those blackheads, sometimes whiteheads. So normally when you have oil production in the sebaceous glands, they just move out of the skin through the pores on the surface of the skin. In case there is a blockade because of dead hair cells or dead squamous cells, then that oil starts collecting, and that will form acne. So it's basically the blockade of sebaceous gland inside the pores or the hair follicles. Now the third one is the decubitus ulcer. Now the important thing about this ulcer is that it is due to pressure lying in one position. And you can see it here that it's just because we are continuously moving, so our blood is flowing, and that's why any area won't gets dry. When a person is paralyzed, especially on the areas of bony prominence, for example, if I'm lying on my side, then this part of my hip bone is too much superficial and will be there lying on the surface, gets a lot of friction, and won't get supply for a long time. So the dependent area, so this word decubitus, it comes from the areas which are superficial and dependent on which the body is lying. For example, it is this area, maybe these prominent bones. So these areas won't get optimum nutrient and oxygen supply. So first they'll get dry, and then this area will burst out, the skin will just tear up, and then it becomes a non-healing ulcer, and it won't heal because we don't have all those oxygen and nutrients there at the place. Urticaria is a common disease of skin which is characterized by these wheals or hives. So these are, if you can see pretty closely, these are red wheals, but they are some sort of elevated like hives, and that's why the term hives comes from. So these are elevated patches. So the difference, the classic feature here is that they are wheals or rounded areas, but they're elevated from the skin. So if you watch them, you can see them, it's just above the skin, and they are red, and it's an allergic reaction to a lot of allergens, and normally we prescribe anti-allergic drugs and remove the source of allergen. The last one is vitiligo. I'm sure you have seen people with vitiligo, and this is basically loss of skin pigmentation. It has a genetic origin, and it's loss of the pigment, the melanin pigment, which gives color to the skin. Alright, let's talk very briefly about some of the dermatological procedures. First, talk about the diagnostic ones, the intradermal and the patch. Now, let's go back to our first lecture where we talked that intra is inside, derma is skin, and we are using this procedure for some sort of diagnosis. So basically, we are injecting some sort of allergen into the skin and see the reaction. So because it's inside the skin, so it's intradermal. One of the common tests is a tuberculin test, which is for tuberculosis. So they just inject a small amount of bacteria inside and see whether there is a formation of a red patch in 48 to 72 hours inside the skin. If you look at this patch procedure, this is again a diagnostic procedure, but instead of putting the needle inside the skin, they just put a patch over the skin. And whatever allergen they are testing, they just put that allergen on the skin and just tape it or patch it up and just leave it for again 48 to 72 hours and see that is there any reaction by the skin. This is commonly done for a lot of dermatitis cases where you want to know the allergen which is producing the allergy, so you can just patch it up and see what's the reaction of body towards that allergen. Some of the surgical procedures, I think I want to talk a lot about biopsy. So biopsy is basically extraction of cancerous cells. Sorry about this bad handwriting. So it's basically that you are putting a needle, I don't know, let's try it here, a needle inside. And for example, if this is a lesion and you suspect that there might be cancer and you can't be sure, so you put a needle inside and extract some of the cells outside, put it on a slide, visualize under a microscope, and see whether these cells are cancerous cells or whether they are differentiated or poorly differentiated or whatever. And it can be of a few types. If it's a very fine needle, then it's said to be FNAC, which is fine needle aspiration cytology. It can be a coarse needle, but this one is more common. Graft is something where you replace a patch of skin. It's extremely common in cases of burn injuries. So if the area is damaged because of the burn, and this is a localized area, so you can get skin from some other part of the body and put it here so that this area can be recovered to normal. A couple of therapeutic procedures, the debridement and the cryosurgery, and we have talked about cryotherapy in our previous slide. So cryo stands for cold, and surgery is a surgical procedure, and debridement is removal of necrotic tissue. So in cases where you have an area of skin which is damaged and you can't heal it, so you remove it. And if you remove it, then you basically debride it. And then the fresh, new, healthy skin will comes from inside, and that's the debridement procedure done for a lot of diseases or different sort of ulcers. I think we are pretty much in there. These are 4 drugs which I want to talk pretty quickly, and that's pretty easy. If you are treating acne, then you are using anti-acne agents. If you are treating fungal infections, then you are using antifungal drugs. They are very common because fungi commonly affect skin a lot, so you need to have all those zole creams, ketoconazole, or all the metanozole creams which are used. Then you have all sort of antiseptic, and if you remember, we talked about septicemia in one of our lectures before. So septicemia is presence of bacteria in the blood, and if it's working against bacteria, that's antiseptic. So all these antiseptic drugs are different antibiotics which can work on bacteria which are there in the blood. And if you talk about corticosteroids, they are basically synthetic steroids, and steroids are naturally produced in our body as steroid hormones from suprarenal gland. If you've remembered, the small glands which are present on top of the kidney. So we have a lot of normal steroids produced on the body, in the body, but they have anti-inflammatory properties. So many a times, if you are looking for a quick treatment or these antibacterial drugs are not responding for a certain infection, then you can always give corticosteroids because of their great and strong anti-inflammatory property. So these are some of the drugs related to treat skin infections. We have talked about anti-acne agents. We have talked about antifungal drugs, the ketoconazole, the fluconazole. We talked about antibacterial drugs, the antibiotics, and the corticosteroids. So that's pretty much it for integumentary system. I know this is a lot of knowledge, so many terms coming up real quick. Go over these videos again and again because they are always be there on the YouTube, and if you have any questions, please let me know. Thank you very much for your time, and I hope really to see you on Friday to start our next system, which is the musculoskeletal system. Stay warm and safe. Thank you very much.